My name is Daniel Leas, and I'm a spine surgeon here at Carolina Neurosurgery and Spine Associates. My interests are basically everything in the adult spine, all the way from the neck down to the lumbar spine. I'm a native to the South, grew up in South Carolina and did undergraduate at the University of Georgia, med school in Charleston at the Medical University of South Carolina, and then my residency back here in Charlotte in orthopedic surgery. My philosophy with patient care is that when I first meet somebody in my office, I let them talk until they feel like they've been able to express what's really bothering them and what's brought them in to see me. I think it's a blessing that we get to see those patients and they get to come with all this history and get to share this experience, and they trust us to listen. So my philosophy is that I'm going to listen and see if they can tell me what their problem is before I even have a chance to look at their imaging or even examine them. Most important to me is making sure that I can match the patient's exam to their imaging studies and to their complaints. And so if that is something that's a more complex deformity, I'm comfortable handling that. If it's something that needs a more minimally invasive approach, I'm very comfortable handling that as well. I like to offer my patients really the full breadth of spine surgery options. It's a little bit like Goldilocks. I like to find the surgery, if they need surgery, that is just right. Not too little surgery, not too much surgery, but something targeted right towards what their symptoms actually tell us that they need. Now, in some cases, that's somebody who doesn't need surgery, and they can benefit then from a really well-coordinated approach with physical therapy, with my partners who focus more on the physiatry side, with injections and other interventions that they may have to offer, and not just the surgical interventions that we offer in our practice. I live in Huntersville, my kids go to school up there, and that's home for me. And so being able to live in that community and provide care in that community is a very rewarding part of my job.